Okay, Amy. Finally got to it. Here it is. Video idea. Most of us recently learned about the risk benefits of steroid epidural. What about SI injections? With my limited knowledge, I assume the epidural has a more immediate risk. All right, hang on a second. I want to make sure, because sometimes y'all use abbreviations that we don't always use every day. Okay, so sacroiliac. Thank you. I don't make a distinction between epidural injections or SI, because the joint, that area is is where your spine connects to your pelvis. It's just a different type of steroid epidural injection to me. Okay, now maybe it's a little less harmful than steroid epidural injections. Maybe. I'm going to go with probably not, though. Okay, it's still very invasive. The risk is that everything applies to. You're still getting into all those nerve bundles, and so I'm not a fan any more than I am the other ones. Now, let's go back a little bit. Let's revisit how I feel about epidural injections. I don't particularly disagree with them. I just don't like them as a sole modality. I don't like when people say you can have injections or nothing else. I don't like when people say that you can have injections. If you want your pain meds, you'll get these injections. I don't like that blackmail. Don't like that at all. I do not like patients' medications being tied to whether or not they say yes or no to these potentially helpful treatments. Not guaranteed, hit or miss, potentially. See what I'm saying? That's my biggest problem with anything related to epidural injections or ablations or SI injections or, certainly the junk, is that they make you feel like if I don't do this, you're going to take my pain meds away. And I have such a huge problem, because even if they don't actually feel that in their head, the two things happening at the same time makes that connection. So I hate that. That's why I manage the medical side of it. And I send my patients to pain management so that when things aren't working, they can just look at it and go, thank you very much for everything you've done for me. And I'm going to go back to my medical doctor now, and we're just going to handle this through pills. I like for them to be able to say that. I like them to have that freedom. I love y'all, no buts.